Hello, dear friends. Welcome once again on We for Nursing TV, and of course, you are together with Jean-Claude Barahirwa, and I'm going to take you with through this gastroschisis presentation. And as an introduction, worldwide occurrence of gastroschisis has risen noticeably over past 2 decades. Like over past 2 decades, the prevalence of gastroschisis has been rising, and that's why we want to create an awareness of the people about this gastroschisis, and so that people can have an overview of it and know how to manage these gastroschisis patients. Gastroschisis is a birth defect affecting the frontal abdominal wall, where the intestines and sometimes other abdominal organ protrudes outside the opening, generally located the right nerve. The umbilical cord is near by the hole. As you see on this picture, there is intestine protruding outside the abdomen, and this intestine protruding outside the abdomen to the right side, you will indicate that this is a gastroschisis. So epidemiology have been saying gastroschisis is now increasing nowadays. That's why we need to know about this, and it is prevalent in lower and middle income countries compared to the developed countries. So among the risk factors, there are something believed to be causing the gastroschisis, like maternal age. It is believed that when the mother delivers a baby, like below 20 years of age, that mother is at risk of developing, like giving birth to the baby who is gastroschisis. There is also maternal lifestyle factors like smoking, alcohol consumption, illicit drugs. These drugs are at a high risk of causing someone to give birth to the baby of gastroschisis. Environmental factors like pet seed, teratogen substance can also expose someone to develop gastroschisis babies. So poor antenatal care, nutritional deficiency can also be risk factors. Like, let's now see pathophysiology, like what happened really for the mother to deliver a gastroschisis baby. The exact cause of gastroschisis is not known. It's not really known. However, it is believed to occur as vascular disruption hypothesis. There are hypotheses that maybe that gastroschisis is due to of it, and let's now explore this vascular disruption hypothesis. It suggests that gastroschisis arises from disturbance of right ompharomesenteric artery or right umbilical vein during early fetal development between 4 and 8 weeks of gestation. This vascular interruption causes localized ischemia and tissue death in developing abdominal wall, resulting in full thickness defect adjacent to umbilical cord. This hypothesis accounts for both characteristics of right side location of the defect and lack of protective sac, as protrusion occur as acute event. So in this vascular disruption hypothesis, it is showing that there is a disruption in vascularizing this right part, this right side of the abdomen during the fetal development, like in early stages of 4 to 8 weeks. And this disruption of vascularization of this abdominal part causes the ischemia to that region. Then after causing ischemia, there is a tissue death there. And then if there is a tissue death, there is a creation of the hole where you will find that the baby is born, but the intestine will be protruding from that hole which was created during this vascular disruption hypothesis. So what should be telling you that the baby delivered is gastroschisis? Like clinical manifestation, the intestine protruding outside the abdomen. You will find that to the right side, the intestines are protruding outside there. There is absence of protective membrane covering the exposed bowels. So when there is a protective membrane covering there, it will now not be gastroschisis. It will now be a non-pharocell. Yes, non-pharocell. So for gastroschisis, there is no protective membrane there. The bowel will be edematous and inflamed, feeding tolerance and red feeding, sometimes dehydration due to exposed intestines. So these are among the manifestations. So there are some complications that would be associated with that anomaly: intestinal atresia, short bowel, sepsis, electrolyte imbalance, poor growth, nutrition. All this will be the complication. Now, how do we diagnose that someone is having the baby who is gastroschisis? You can do an ultrasound, like with high resonance. It can show you that the baby is gastroschisis. You can do some investigation, like taking this serum alpha protein. When it is elevated, it is an indicator that there is a baby with a defect in the abdomen, which can lead you to the ultrasounds, so that you can check well the morphology, the physical features of the baby, to see if it is the gastroschisis. Postnatally, you can do clinical examination and you will easily identify the gastroschisis, as we have shown you on this picture, that the intestine will be protruding outside. So without taking much time, let's now go to the management. After you, like, suppose like we are in the given a healthcare setting, you deliver a baby, you just helped the mother to deliver a baby, and you find that the baby is gastroschisis. What you do immediately, it is to protect the exposed bowel urine using the sterile plastic wraps. You just have these plastic bags, and you just cover the intestine in a sterile way, so that you protect the intestine from infection, from dehydration, and from being even teared of any other external objects. So you just cover them. What you do next, it is to insert nasogastric tube. Because this baby with the gastroschisis, they are having bilious vomiters, so you will insert nasogastric tube mainly for two reasons. For nasogastric tube, it will help you to decompress these bilious content which are in the abdomen. Number two, it will help you to give out the air which is entering the abdomen just from the nose. You know that when someone is having the respiration, spontaneous respiration, there are some air which are going in the airway part, in the lung and whatever, but there are also the other one which can go in the abdomen. So this nasogastric tube will help you to take out that air, so that the intestine will not continue being enlarged. So the next thing we do, it is to do fluid resuscitation. Just give enough fluids. You know that the intestines are outside, the patient is at risk of dehydration, so provide enough fluids. Make sure that the patient, the baby is not being killed by the temperature. You have to make sure that the temperature is well monitored. You have to administer the broad spectrum antibiotic. This is one, it should be a mandatory, because these exposed intestines are at high risk of developing sepsis from that baby. So it's very much important that you administer a broad spectrum antibiotics. Then when you are in the tertiary hospital, they are going to do a surgical operation, maybe by primary closure, opening the abdomen, and then they put in the exposed intestines, and then they close if the abdominal cavity is large enough to accommodate such. And if it is not that, you do a staged reduction using a zero bag followed by delayed closure. And this staged reduction, and it's a preferred method in many settings where there is a zero bag applied to the intestines, and gradually that zero bag is going to be reduced, intestine being reduced in the abdomen, not on the same day as the baby was delivered, but you just apply the zero bag today, the other day you do a reduction, the other day you do a reduction, and then you find that the intestines, all of them, they are now entered the abdomen, and then the zero bag will be removed, and the wound will be closed, and then the rest for some period, and then later the baby will recover very, very well. So this stage reduction, it is another surgical method, but this one is performed by pediatric surgeons, and it has a good success rate. So what you have to do also in the management is parenteral nutrition until the bowel function returns. For the baby with the gastroschisis, we have found that during birth and in this stage reduction, most of the time they have bilious content. So to administer something oral, it is prohibited. The mother will not breastfeed. So you can search for parenteral nutrition for these babies so that you can prevent malnutrition, so that you can boost the immunity, so that you can boost the healthy baby instead of giving IV fluids only. Management involve multidisciplinary, neonatologists should be there, pediatric surgeons should be there, pediatric nurses should be there, nutritionists, social workers. They all have to work as a team so that they can save this baby of gastroschisis. Why psychologists are involved? Psychologists are also very important because the mother most of the time, or the parents, are surprised of this kind of baby. Most of them, it is their first time to see that, so they should be provide this counseling to the parents. So this is what we can tell you about gastroschisis. I hope when you meet the case, you'll be able to manage. Thank you.